my routine medications while breastfeeding? Or can I use any medication at all? Is it safe for my baby? All these questions and more I will be answering on today's episode of the Global Health Pharmacist Podcast. Hello everyone, welcome to another interesting and educative episode of the Global Health Pharmacist Podcast. I mentioned in my previous episode that I was going to do an episode about World Breastfeeding Week, which runs from 1st to 7th August yearly. Well, breastfeeding is such a gift and it helps new mothers bond with their newborns. Not only that, it provides the baby with essential nutrients needed to thrive in the first few months of life, as well as some immune boosting elements. This year's theme is breastfeeding for a sustainable start in life, strengthening what works. It focuses on how breastfeeding impacts nutrition of the newborn and also encourages expanding access to skilled infant and young child feeding counseling while calling on government, health systems, workplaces, and families to build a continuous network of care for nursing mothers. However, I will be talking today from a pharmacist perspective and educating new and expectant mothers as touching medications used during breastfeeding. I believe this is important because a lot of mothers are on some routine medication or were on some routine medication before pregnancy, and some still have to use them, right? Some also have to use some medications for some periods after giving birth by either cesarean section or by spontaneous vaginal delivery. And majority of these medications are passed through the breast milk to the newborn. So care must be taken, right? I am glad that I have talked about maternal and child health a lot on this podcast from years back up until recently. I have done an episode on drug use in breastfeeding, as well as one in the drug discovery series about oxytocin, which is an hormone that plays a major role in breastfeeding. I will leave the links to those in this episode somewhere, right? So that you can learn from those as well. Today's episode will essentially be a video recap of that episode I made a while back about drug use in breastfeeding, which is about 2 years back, with some newer information. So, having said all this, without further ado, let's get right into it. Like I said, a lot of new mothers still have to take medications after giving birth, because the fact that you're breastfeeding doesn't mean that you should not use medications when you need them, right? And these medications will be passed on to the newborn babies through breast milk most of the time, because that is one of the routes of drug elimination from the body. Do not forget that it is advised that babies should be breastfed exclusively for at least 6 months to ensure that they are healthy. Breastfeeding as soon as possible after the baby is born is very important because the colostrum, which is the first nutrient-rich milk produced the first few days after delivery, has a high antibody content, which helps the baby to fight infections and also acts as a natural laxative to help the baby pass early waste from the body. This is why the breast milk is called liquid gold. Since the baby's immunity is still developing and the organs are not mature enough to help excrete some substances from the body, new mothers must be careful what goes into their body that they are passing to the baby through the breast milk. This takes me to the crux of our discussion today. What drugs are safe for use by a mother who is breastfeeding, and if they must take some not so safe medications while breastfeeding newborns, what should they do? I'll be answering these questions and give you a bonus by examining the facts behind drugs and supplements that have been claimed to help with breast milk secretion or production. So, you can see that this episode is packed with lots of information that are very useful for you and your child's health. That's your cue to pause and share with a new or expectant mother before we continue. Or you could do that after you have washed as well. Either one works for me, okay? So let's start with the big question that keeps so many nursing parents up at night. I say nursing parents because nowadays fathers are also involved in taking care of newborns. It's not just the mothers, right? And it's a welcome development if you ask me. So mothers will ask, if I take this pill, how much of it is actually getting to my baby? As a pharmacist, I see a lot of mothers have anxiety about this all the time. But here is the comforting truth. Your body has an incredible built-in filter. For a medication to end up in your breast milk, it has to move from your digestive tract into your bloodstream, across the tissue of your mammary gland, and finally into the milk itself. In the vast majority of cases, the amount of drug that actually makes that entire journey is very small. In pharmacology, we evaluate this using something called the relative infant dose, or RID for short. You don't need to memorize the math or anything, but conceptually, what it means is that the RID measures the percentage of the dose you took that actually reaches your baby through your milk relative to your weight. As a general clinical rule of thumb, if a medication has an RID of less than 10%, it is considered safe for a healthy full-term infant. And here is the reassuring part. The overwhelming majority of routine over-the-counter and prescription medications, like your standard headache relievers or your basic antibiotics, have an RID of well under 1% to 2%. That means your baby is receiving a tiny, negligible fraction of what you took. There's a caveat here though. This doesn't mean that all drugs are safe as long as only a tiny fraction reaches your baby. Drugs like antibiotics, even if passed to the baby in the tiniest fraction, can lead to antimicrobial resistance, especially if taken by self-medication without the guidance of your healthcare provider. I just had to put that out there, so keep that in mind. Now that we know that most medications transfer into breast milk in tiny amounts, let's talk about the sneaky trapdoors in your local pharmacy. That is your over-the-counter cold and allergy remedies. When you're nursing and come down with bad cold, during winter season, during rainy season, depending on your geography, your instinct is to grab a multi-symptom cold syrup or a decongestant pill. But this is where we have to read the fine print carefully, because some of these ingredients don't necessarily harm your baby directly. They eat your milk supply. That is, they might reduce your milk production generally. The biggest offender here is pseudoephedrine, which is the active ingredient in many oral decongestants. Pharmacologically, pseudoephedrine works by constricting blood vessels to clear up nasal congestion. But it also exerts a powerful effect on your hormonal system by suppressing prolactin, that hormone that I talked about, which is the primary hormone responsible for driving your breast milk production. Clinical studies shows that even a single 60 milligram dose of pseudoephedrine can cause a sharp, noticeable drop in your milk yield within 24 hours. If you're already struggling with supply, as some mothers do after delivery, an OTC cold pill can feel like a sudden brick wall. That is, within 24 hours, it can stop your milk supply totally. So, what should you take instead when you're congested or in pain? First, for pain and fever relief, your best first-line options are ibuprofen, which is an NSAID for pain, and acetaminophen, also known as paracetamol. Ibuprofen is an absolute superstar during lactation because it is highly protein-bound in your blood, meaning that almost none of it passes into your milk. Plus, it actively targets inflammation, making it great for clogged ducts or post-delivery soreness. If you're battling severe nasal congestion, skip the oral decongestant pills and opt for saline nasal sprays or short-term use of localized nasal decongestant sprays like oxymetazoline. Well, you don't have to memorize all of this. Just talk to your healthcare provider, your pharmacist. Tell them you're breastfeeding, you need a localized nasal decongestant. They will give you that, okay? Because those localized decongestants act locally in your nose, and systemic absorption into your bloodstream, and therefore your milk is virtually zero. And if you are experiencing allergies, try to avoid the older first generation antihistamines like diphenhydramine, because they can make you and your baby drowsy and potentially lower your milk supply as well. Some cough syrups also contain these drugs too, so watch out for that as well. Instead, opt for second generation options like loratadine, cetirizine, which stay out of the central nervous system and are far safer in breastfeeding. Now, this brings us straight to one of the biggest myths in maternal health, the dreaded pump and dump. Many new moms throw away precious liquid gold, sometimes large volumes of pumped milk, simply because they took an ibuprofen, had a single medical procedure, or took a needed medication believing that their milk was suddenly poisoned. Let's set the record straight here, okay? Pumping your milk does not filter or cleanse the medicine out of your body. Breast milk is actually in dynamic equilibrium with your bloodstream. As your liver and kidneys clear the drug from your blood, the concentration of the medication in your breast milk drops right along with it. So pumping out the milk doesn't actually speed up the process. Time does. So when should you actually pump and dump? It's only in very specific high-risk scenarios. For example, if you've undergone a diagnostic procedure involving radioactive isotopes, or if you're taking specialized heavy-duty treatments like chemotherapeutic drugs or some specific immunosuppressant. In those rare cases, pumping maintains your supply because you still have to keep pumping to let your brain know that this milk is still needed, and dumping prevents exposure while the drug active window passes. What I mean is that while you dump, that period, the half-life of the drug, in which the drug level in your blood and your breast milk eventually will reduce, so that the new one you'll be giving to your baby will be free of that particular medication. I hope you get that. For almost everything else, from short-term pain relief to managing a fever, you do not need to throw away your milk, okay? Before you pump a single drop out of fear, walk up to your local pharmacist and ask us directly, okay? We can look up the exact RID and half-life of what you're taking in seconds and advise you accordingly so that you can keep feeding your baby with total confidence. You could also talk to your doctor or your nurses. They can help as well, all right? Switching gears now, let's address the opposite end of the spectrum. What happens when you're actively trying to increase your breast milk supply and you're targeted by endless ads for teas, cookies, drinks, and herbal supplements? In the medical world, substances that promote lactation are called galactagogues, and while marketing campaigns make herbal galactagogues look like magical, risk-free solutions, as a pharmacist, I will advise you to approach them with a healthy dose of caution. Take fenugreek, for example. It's one of the most widely used herbal lactation supplements. While some parents swear by it, the clinical evidence supporting fenugreek is actually quite mixed and largely anecdotal. That is, they are not backed by research. Most importantly, fenugreek isn't harmless. It belongs to the same plant family as peanuts and chickpeas, meaning that it can trigger allergic reactions. Even in your baby, you know that you have to take note of allergies even for babies, right? It can also cause GI upset in both you and your baby. It can cause lower blood glucose levels as well, and even interfere with your thyroid hormone regulation. Another popular herb, moringa, has shown promising results in early clinical trials for stimulating prolactin, but quality control and dosing standardization in commercial supplements remain a global challenge because dietary supplements aren't strictly regulated before hitting pharmacy shelves. I've talked about supplements also on this podcast, and I've given my advice when it comes to them, so you can also visit that episode to learn more, all right? Also, there's this popular one used in Nigeria, where I'm from, where new mothers drink palm wine to help breast milk production. Palm wine is locally produced wine from a palm tree. This is just a cultural myth without scientific evidence to back it up, because any temporary fullness comes from liquid intake, not the palm wine itself. Besides, it can be counterproductive in the sense that palm wine contains alcohol, which passes directly into the breast milk, and the alcohol content of palm wine ranges between 3% to 12% depending on the fermentation process. Alcohol actually inhibits the hormones for optimal milk release and flow. Also, there is no known safe level of alcohol for a nursing infant whose developing body cannot process alcohol efficiently. So it goes without saying that it poses various risks to the baby, ranging from sleep disruption to sedation or agitation, as well as reduced milk intake by the baby. So you want to avoid that. So if I should avoid this, what should I take? That takes me to prescription galactagogues. You know, these are medications that have been found by research to actually increase breast milk production. Medications like domperidone or metoclopramide are sometimes prescribed off-label to raise prolactin level. But these are potent drugs with real side effects as well. The side effects include maternal mood changes, depression, and cardiovascular considerations. I've talked on this podcast as well that taking medications has to do with the risk and benefit ratio. If they see that the risk is minimal compared to the benefit you get, you can be prescribed these medications. So they actually require close medical supervision, and they are never a first step. Use them as last resort, mind you, after you must have tried all other healthy options. So here is the core clinical truth I want every parent to hear. No pill, herb, tea, drink, or cookie can replace the psychological demand of frequent, effective milk removal. Lactation is a supply and demand feedback loop driven by infant latching or mechanical pumping. Also, there are safer ways to boost milk flow if you must. Before spending your hard-earned money on expensive supplements and other stuff that might cause side effects, focus on nursing your baby frequently on demand to naturally stimulate production. Staying hydrated, eating a healthy, well-balanced diet, and working directly with your healthcare provider, your doctor, to rule out underlying structural or hormonal issues are very great options, okay? To wrap things up today, my advice to mothers is this. Dear mothers, please remember that taking care of your health is not selfish. It is an essential part of taking care of your baby. You do not have to suffer through pain, infections, or illnesses in silence out of fear of harming your milk. Safe, effective options exist for almost every condition. What you have to do is get the advice of your healthcare providers, okay? So the next time you are unsure about a medication, walk right up to your pharmacist in your community or hospital pharmacy or your doctor or your nurses as well and ask your questions. We are trained, accessible, and always ready to double check the science so that you can nurse with clarity and peace of mind. That is what I have for you on today's episode. Thank you for tuning in to this World Breastfeeding Week episode. If you found this useful and helpful, please share it with an expecting or nursing parent in your life. And don't forget to like, share, comment, and subscribe, okay? Till next time, stay healthy and God bless you. Bye!